Hi, my name is Kristin Bernstein, and today we're going to talk about a couple of the medications that are available for stroke prevention in chronic atrial fibrillation patients. Atrial fibrillation, or AFib, is an arrhythmia of the heart that is characterized by ineffective electrical activity within the atria, leading to ineffective functioning of the atria. When the atrium becomes irritated, such as from atrial enlargement, a cycle of electrical stimulations can occur throughout the atrium at once, preventing any kind of coordinated contraction from occurring, which disrupts the blood flow from the atrium into the ventricle. Blood then pools or cycles within the atrium, and this increases the risk of embolus development. These emboli can then travel to the brain and occlude a vessel, leading to stroke. Therefore, chronic atrial fibrillation patients require some degree of anticoagulation therapy. This can range from a daily baby aspirin to the use of oral anticoagulants such as warfarin or one of the newer oral anticoagulation therapies such as rivaroxaban. We're going to use an infographic today to discuss the difference between warfarin and one of the newer ones, rivaroxaban, also known as Oertel. So because of the nature of the clotting cascade and the fact that there's numerous factors involved, there's a few different places that we can insert medications to prevent the development of the clot itself. So warfarin functions by inhibiting the synthesis of a few of these clotting factors, namely 2, 7, 9, and 10, by preventing the regeneration of vitamin K. Versus Oertel, which inhibits factor XA, which is responsible for the conversion of prothrombin to thrombin, which then creates fibrin, or the mesh-like aspect of the clot itself. There's a lot of drug interactions with warfarin, which causes some issues. So these include sulfas, amiodarone, fluconazole, and alcohol. There's also dietary restrictions to consider with warfarin because of the vitamin K, and vitamin K must be restricted within the diet. Oertel only has a few, namely digoxin, verapamil, amiodarone, or any of these PGP inhibitors. Both of these medications are very effective in stroke prevention if taken appropriately. However, the Oertel has a faster onset and offset of action, and therefore it doesn't have to be stopped as long before and after a surgical procedure. So that limited time frame that the patient is not anticoagulated will reduce the risk of stroke during that time. Safety: both of these medications, because of the nature of what they do, carry a risk of bleeding. But warfarin has a major advantage on this front because it can be reversed. So if the patient does have an episode of bleeding, they can be given vitamin K or FFP to reverse the action of the warfarin and hopefully slow down or stop the bleeding that's occurring. However, Oertel does not have anything like this. Oertel is also eliminated renally, and therefore if the patient has any episode of kidney dysfunction, then the levels of Oertel can build within the blood and increase the risk of bleeding. Warfarin may have a lower initial cost, but because of the frequent lab monitoring that must be done, and patients can have copays associated with these, the overall cost can tend to be higher than it is with Oertel. For both of these medications, our expected outcomes are that we hope to have full prevention of stroke and limited complications from any episodes of bleeding. So because of these different things to consider, there's a lot of lifestyle factors, and it really needs to be a discussion with the patient to determine which medication is better for them, how is their mobility, as far as do they have a higher risk for falls, and then we have to be careful with something like Oertel that we can't reverse in case they do have an episode of bleeding. Patients who travel a lot or who aren't up for the frequent lab monitoring that's needed with warfarin might have more issues with a medication like that. So it really has to be a risk and benefit discussion with the patient so that they can make an informed decision for their health care. Our references are listed below. Thank you for listening.